Wildfires stretching across Alberta, Saskatchewan, and Manitoba are having an impact on air quality now right across the region. But now, as I was mentioning yesterday, smoke all the way drifting across the Atlantic into Europe. And it brings with it, in that smoke cloud, fine particulate matter, which can do all sorts of damage to our health. That's what we've been talking about every wildfire seasons for the last few, and we're going to do so again with our guest, Dr. Samir Gupta, who is a respirologist, so important to us, and an associate professor in the Department of Medicine at the University of Toronto. Welcome back. Here we go again. Conversation we've been having for the last, if I'm not mistaken, this is our third consecutive wildfire season as they've worsened.
Yeah.
And this is one that's likely to continue.
It's something, Heather, that really is becoming almost a chronic problem. You know, chronic intermittent. And it used to be these rare one-off events where, okay, there's this massive pollution exposure. But now we're starting to think of it as what happens to your body when you have to breathe this in every single season, every
and
wildfire
longer
season.
Seasons and more intense. And we talked about it last year. I remember one of our conversations about how we should see wildfires as a health issue. You know, it's not just an environmental issue, it's also a health issue. You know, we just got, literally as I was coming from my desk over here to our studio here, an air quality warning from the province of Manitoba just about an hour or two ago, talking about air quality from the fires in northern Manitoba, warning of periods of poor air quality, and then smoke levels increasing and health risks increasing as well. There is a particular health risk associated with wildfires. Let's go over what that is again.
Yeah, so, you know, wildfires are a little bit different than conventional pollution. What we worry about is the tiniest particles, and the tiniest particles in wildfires are very carbon rich. So it comes from living material, it comes from burning of carbon rich material. And so that type of pollution seems to be even more irritative and inflammatory, cause more inflammation in the lungs. And so what we know is that when you breathe this in, you have these tiny particles, nanoparticles we call them, that go straight through the lungs.
We have that graphic, how small they are, even related to the human hair. This is the one we've looked at over the years, just to give you an idea of how tiny this particulate matter is.
That is. The PM 2.5 that you point out there is 2.5 microns, or millionths of a meter or smaller. And those particles not only damage the lungs on the way in, but when they make their way into the bloodstream, they spread to every organ in the body. So when we have these events, we see in the emergency room more people with lung diseases like asthma and COPD coming in with symptoms and flare-ups, but we also see more heart attacks, we see more heart failure, we see more strokes. So the effect on the body is really every single organ because it gets into the bloodstream.
When you talked about chronic earlier, this is something that you are looking to, other researchers are looking to, if we have more of these prolonged wildfire seasons with more of these prolonged health risks, conditions like asthma, types of cancer, if you've got this material circulating in the body more and more, long term it's concerning.
It is concerning, Heather, and we know more about pollution in general, which is pollution from agricultural, from industrial sources, from automobiles. So again, this is a little bit different in its nature, but if you look at with pollution in general, many bad outcomes. First of all, just a higher chance of dying if you live in a more polluted environment, more polluted city, higher chance of having lung disease, of having lung cancer, of susceptibility to lung infections. And then if you look at wildfire, again, because it's becoming more chronic, we're starting to have some data on what the body effects are of that repeated exposure. So there was a study that showed that if you're within 50 kilometers of recurrent wildfire events, you have a higher risk of lung cancer and brain cancer. If you look at wildland firefighters who are exposed to more of this smoke, they have lower lung function. They have more lung cancer, they have more cardiovascular disease, more brain cancers as well. They have more mood disorders. So there's all sorts of different things that may be happening with this exposure that we're going to learn about in the years to come on the general population.
Over the longer term. Let's talk a little bit. We may have this conversation many times over this wildfire season, but for right now, as we start really hearing about air quality impacts beyond that immediate Manitoba, Saskatchewan, people who are outdoors, how do people deal with poor air quality? What should they keep in mind if they are outdoors?
Yeah, so, you know, that's the first starting point is if you can avoid it, don't be outdoors, because that's where the pollution is. And, you know, the human lungs are the great filter. 10,000 liters per day go through the lungs, so all that pollution goes through the lungs. If you have to be outside, wear a mask. You know, add an extra filter so it's not your lungs filtering that pollution, it's the mask filtering it, ideally an N95 mask. And don't forget that if you're exercising outdoors, you're breathing more. So when you're going for a jog in the pollution, you're breathing 10 times as much air. That's 10 times as much pollution. So if you have to be outside, don't exercise if you can avoid it, and wear a mask.
Okay, and indoors is time again to think about, as we've discussed before, improving indoor ventilation.
Yeah, so with indoors, keep the doors and windows closed, keep that pollution out. Once you're indoors, then you're going to use your HVAC system, you're going to run it continuously, make sure you've got a good filter on it, keep replacing your filters on it. If you don't have a good HVAC system or you don't have a good seal from the outside, some of that pollution will get in. You can look at that. You can actually measure that. There are relatively inexpensive home sensors now, pollution sensors that you can use, people can acquire. If you have high levels of pollution of that particulate matter inside the home, and you don't have a good air filter, you can buy a good HEPA filter, but they're expensive. You can also build your own. If people go online and look up Corsi Rosenthal box,
That's what it's called.
It's called that, and you take a box fan and you put a bunch of furnace filters around it, and relatively inexpensively, you can have a very good filter for within the home as well.
DIY. For self-protection. Dr. Gupta, thanks. I'll end it at that for now, but there may be questions. We'll talk about this, I'm sure, to come, just getting going as we see the risk intensify in the country. Thank you very much, as always, for today.